This voiceover will cover respiratory pharmacology. Short-acting adrenergics are used for asthma and COPD. These medications bind to beta-adrenergic receptors in airway smooth muscle. They're considered your rescue inhalers. Onset is 5 to 15 minutes, peak is 60 to 90 minutes, and duration is 3 to 6 hours. Concurrent use with other adrenergic medications will increase adrenergic side effects. Use with MAOIs may lead to hypertensive crisis. Beta blockers may negate therapeutic effect. These drugs may decrease serum digoxin levels. Hypokalemia is a side effect which increases the risk of dig toxicity. Cardiovascular effects may result in clients taking tricyclic antidepressants. Side effects of short-acting adrenergics include nervousness, restlessness, tremor, paradoxical bronchospasm, chest pain, and palpitations. Long-acting adrenergics have a little bit of a different onset, peak, and duration. The onset is 10 to 25 minutes, the peak is 3 to 4 hours, and the duration is greater than 12 hours. Long-acting adrenergics should not be used to treat acute symptoms. A rapid-acting inhaled beta-adrenergic bronchodilator should be used for relief of acute asthma attacks. Short-acting anticholinergics are used as maintenance therapy for COPD. They inhibit cholinergic receptors in bronchial smooth muscle. Onset is 1 to 3 minutes, peak is 1 to 2 hours, and duration is 4 to 6 hours. They may increase anticholinergic effect with drugs having anticholinergic properties. Side effects of short-acting anticholinergics include dizziness, headache, nervousness, blurred vision, sore throat, bronchospasm, cough, hypotension, palpitations, nausea, and rash. Long-acting anticholinergics also have a different onset, peak, and duration. The onset is rapid, peak is within 5 minutes, and duration is 24 hours. Side effects include paradoxical bronchospasm, tachycardia, dry mouth, constipation, urinary retention, and angioedema. Anti-inflammatory respiratory medications include intermediate and long-acting corticosteroids, as well as leukotrine antagonists. Intermediate-acting corticosteroids have an unknown onset, a peak of 1 to 2 hours, and a duration of 1.25 to 1.5 days. Chronic treatment will lead to adrenal insufficiency, so it's important to use the lowest dose for the shortest period of time. Side effects of intermediate-acting corticosteroids include depression, peptic ulceration, anorexia, nausea, hypertension, decreased wound healing, ecchymosis, petechiae, adrenal suppression, thromboembolism, muscle wasting, osteoporosis, increased susceptibility to infection, and fluid retention. Dexamethasone is a long-acting corticosteroid and can be administered either PO or IV. The onset is more rapid with IV administration. Duration is 2.75 days. Leukotrine antagonists are used for prevention and chronic treatment of asthma. The onset is within 24 hours, the peak is 2 to 4 hours, and the duration is 24 hours. Side effects include suicidal behaviors and thoughts and Stevens-Johnson syndrome. Respiratory medications can be administered PO, IV, or via nebulizer. Many facilities have a respiratory department that will handle the nebulizer treatments. Another method of administration is through a metered dose inhaler, and they can have a spacer attachment. And this is to increase the likelihood that all of the medication will enter the lungs. Corticosteroids should not be discontinued abruptly because this can lead to adrenal insufficiency. The client should rinse their mouth after corticosteroid inhaler use to reduce their chance of developing thrush. Never use a long-acting bronchodilator as a rescue inhaler because they have different onset, peak, and durations. The nurse should monitor the client's vital signs and whether they're having any side effects to the medications. Client teaching should be performed so the client is aware of how to properly administer the medication, any possible side effects, and when to take the medication. Later on, we'll talk about peak flow monitoring.